Pregnancy is a really profound time in a woman's life where there are really rapid and massive changes that are actually happening. So virtually every organ system within the body is being affected. Over the 9 short months of pregnancy, blood volume is increasing by about 50%. Heart rate is going up about 15 beats per minute. The amount of blood that your heart is beating is going to increase by about 30%. Impressively, your heart actually grows and gets stronger while you're pregnant to be able to accommodate all of these different changes. So when you are starting to exercise during pregnancy, it's important to understand that your resting heart rate will be going up. You might experience increased breathlessness. This is very common. We call it dyspnea during pregnancy. You might feel at rest you're breathing a little bit faster, a little bit harder. But as soon as you start to exercise, some of these adaptations are going to normalize and actually improve when you begin exercise. Other adaptations that will change as the uterus is growing, the uterus and the baby starts to get bigger. It's actually raising and compressing your lungs so that your diaphragm raises and your lungs are actually going up a little bit higher in your chest cavity. Your chest is going to, your ribs are actually expanding to be able to accommodate this. And so as a result, many pregnant women will experience some form of breathlessness or dyspnea during her pregnancy. Very normal adaptation, very much expected, but if you're not expecting it, it can be a bit surprising. Another one we like to talk about is the hormone relaxin. So relaxin is an important hormone that's going to increase well in your body while you're pregnant. It's designed to allow for delivery of the baby, but while your skeleton is going to, and especially your pelvis is going to open to allow the delivery of the baby, it's actually not causing instability of your pelvis, and it's not necessarily related to the pelvic girdle pain or the low back pain that you're experiencing. Relaxin will stay in your body after delivery as well, but as soon as you've stopped breastfeeding, it will start to disappear and your body goes back to normal again. We already talked a little bit about the physiological adaptations that occur during pregnancy. Now, we consider this to be a stress test for life in that if you develop conditions during pregnancy, such as gestational diabetes or hypertension during pregnancy, that this can predict the future development of overt type 2 diabetes and overt hypertension later in life. Now, the great thing about this, it's unfortunate if you do develop these conditions, but the nice thing is that now you're aware that you're at increased risk for developing these chronic diseases later in life. And the postpartum period is a perfect time to implement lifestyle interventions such as increased levels of physical activity, improved diet, and overall health to be able to prevent the development of type 2 diabetes and hypertension later in life. So we know that people who experience gestational diabetes or high blood pressure during pregnancy, that they're at increased risk of developing these conditions in the postpartum period. We also know that people who develop those conditions during pregnancy, in some cases, they actually had pre-existing diabetes or hypertension that had just not been diagnosed before. So we do recommend being screened in the postpartum period to see if you do have type 2 diabetes or hypertension. If you do, you want to speak to your healthcare provider and make sure it's treated. And if you don't have it, recognizing that the postpartum period is a really great time to improve your lifestyle, engage in greater amounts of physical activity, and improve or focus on healthy eating habits, which can help to reduce the risk of developing overt type 2 diabetes and hypertension if you develop these conditions in pregnancy. Some of the changes will reverse almost immediately after delivery. So one of the most profound changes that happen during pregnancy is that you have a 50% increase in your overall blood volume. When you deliver the baby, actually within a couple of days, your blood volume is going back to pre-pregnancy values. Your breathing rate and how you breathe will also go back down to normal as soon as you deliver the baby. But other adaptations, such as the change in the size and the strength of your heart, we know that those changes will persist for quite a while postpartum. Data is suggested up to about a year postpartum. The really interesting thing with that one is that we know, or data has shown, that athletes who are returning to their sport in the postpartum period, that they can actually have maintained or even improved performance. And we believe part of this is because their heart is actually stronger and able to work a little bit harder in the postpartum period. So this is actually a really newer area of study. It's called the developmental origins of health and disease. So big words, but basically what it means is that the environment that you actually build within your body during pregnancy can impact the health of your baby and predict whether or not the baby is at increased risk for developing hypertension, type 2 diabetes, or obesity later in life. What we've actually found is that moms who are active, physically active, and eat a healthy diet during pregnancy, that their children are born a healthy size and they're less likely to develop chronic disease conditions later in life. Now, the really fascinating thing is that if your fetus is actually female, the ovaries are developing in the fetus as it's growing. And so the environment that you have during your pregnancy can potentially impact that third generation later on. So while we're still trying to understand the impact of exercise during pregnancy on the health of the baby, there's emerging evidence coming out now which is starting to suggest that if a pregnant individual is exercising during pregnancy, their baby is actually going to have a slightly stronger cardiovascular system. So the heart is working a little bit better, blood vessels are a little bit healthier in the baby after delivery.